There is no cholera in Migori.
Kapod wantiere kaunti no ma Migori wedo ne kar thieth mar Equity Afya mabende en mano mar bengi mar Equity ya bade e boma ma Migori ka koro kelo kwana bede magiseyo bombe chopo 102 chenro no noteli kod jatatije mar Equity Afya Samson Mwangi kod jatend migawo mar thieth kaunti ma Migori Julius Nyerere. Mwangi owacho ni kaka kar thieth gombo margi en medo kuonde mag chiwo thieth Kenya mangima mondo gikony piny owacho keto yot ne oganda e yudo thieth. Medo ni gibiro bedo ka gichiwo okumba mar thieth mondo oganda obed kod yot e yudo thieth. Jatend migawo mar thieth e kaunti ma Migori Julius Nyerere ne owacho ni biro mar Equity Afya dhi konyo e bero weche mag thieth e kaunti no.
And I only get a phone call that mom was sick.
It's faith-based organization.
Yeah, we are really pleased to be here today to be launching our 102nd of the Equity Afya network. Today, as I said earlier, we are opening 7 of them, and our intention is to grow the population of these units to 300 this year in Kenya and 1,000 in the region by 2030. Equity Group thought right that we not only assist families to grow economically, but also to protect that wealth that they create. And so without health really, productivity is significantly affected. And hence the reason why the group is very intentional, providing that affordability, quality, and access.
We work together with private sectors to improve quality health care because health is very broad and very critical. And we have roped in Equity Afya to help us in meeting PCN. PCN means Primary Care Network. So this is going to be a spoke, and then we have other hubs. So our intention is to expand so that everybody can access medical facility, quality one.